Hello, everyone, and welcome to our national webinar, Human Trafficking and the Impact of COVID-19. I am Rayanne Passantino, Interim Director of the Family Justice Center Alliance, and on behalf of Casey Gwynn and Gail Strack, President and CEO respectively of Alliance for Hope International, thank you so much for joining us today. We appreciate you spending some time with us. We have a few webinar reminders that this presentation is being recorded and it will be posted on our website. You will receive an email with instructions on how to download the webinar and the recording and review all the materials and to access your certificate of attendance. And as Sarah mentioned, please submit any written questions throughout the webinar and our team will read them back to the presenters who will then be able to answer them. We always like to thank the Office on Violence Against Women, in particular Principal Deputy Director Laura Rogers and our wonderful Program Manager Kevin Sweeney for their support of our technical assistance work across the country. We also love to recognize our staff, our HOPE team, and in particular, I would like to acknowledge program admins Kayla Halsley, who put this webinar together, and Riley Shore, who is handling the behind the scenes logistics. Thank you, both of you, for your hard work in getting this webinar together. We also want to thank and honor our national advisory and operating boards who provide so much support to Casey and Gail and all the work that we do at the Alliance. So your presenters today are Philip Gneidig and Angie Rodriguez of CAST. Philip is the Interim Co-Director of Empowerment Programs and Task Force Coordinator at the Coalition to Abolish Slavery and Trafficking, a leading anti-human trafficking agency based in Los Angeles, California. Philip is a licensed social worker who has spent the last 8 years supporting programs for victims of crime and trauma. Philip currently oversees a variety of CAST programs for human trafficking survivors, including its intensive case management program, emergency response services, survivor leadership program, and Los Angeles Regional Human Trafficking Task Force in collaboration with the Los Angeles Sheriff's Department. Before entering the anti-trafficking field, Philip worked in various therapeutic settings, including crisis and shelter services for minor victims of abuse or neglect, outpatient programs for adults with severe mental health issues, as well as advocacy roles in NGO committees on migration and indigenous peoples at the United Nations as a member of the International Federation of Social Workers. Philip holds a bachelor's degree in history from Duke University and a master's degree in social work from Fordham University. Angie Rodriguez is the clinical supervisor also at CAST. Angie is a licensed clinical social worker with 10 years of experience working with survivors of trauma. Angie currently oversees the Intensive Case Management Program and the MSW Internship Program at CAST. Before working at CAST, Angie was the Director of Behavioral Health at Local Community Clinic in Los Angeles. Aside from working with survivors of human trafficking, she has also worked with asylum seekers and domestic violence and sexual assault survivors. Angie holds a bachelor's degree in international studies from Marymount Manhattan College and a master's degree in social work from the University of Southern California. We are very honored to have Philip and Angie with us today. So please take it away.
Hello, good morning or good afternoon, depending on where you're joining us from. My name is Angie Rodriguez, and yes, I am the clinical supervisor at CAST. And Phil, do you want to do a quick intro?
Yeah, and good morning and good afternoon as well. And I am our interim co-director of empowerment programs, also at CAST in Los Angeles, and excited to be here with you all today.
So today we are going to talk to you guys about the topic or issue of human trafficking and what that's looking like today with the pandemic that we're all dealing with currently.
And
So
we also just
go ahead.
wanted to, oh, sorry. As we go through the slides, we'll be covering some things that might be broader human trafficking related as well as COVID impact. And sorry, Angie, I realize you're going to highlight that now.
No worries. But yeah, so as Phil mentioned, this is our agenda for the training today. So we'll kind of go over what, as far as human trafficking, what we're seeing in California, and a lot of our numbers, just a heads up, are local. And I'm going to talk later about how there is unfortunately no good data when it comes to tracking survivors of human trafficking. But we will obviously try to give you probably somewhat accurate information as far as in Los Angeles County and California. We're going to then go into the definition of human trafficking, then the intersection of human trafficking, intimate partner violence, and sexual violence, how to identify human trafficking survivors, the services and the resources for survivors, and then we'll end with the impact that the pandemic has had on the community we work with. So before we start talking about human trafficking, I wanted to share a little bit more about CAST. So we, CAST stands for the Coalition to Abolish Slavery and Trafficking, and we are a nonprofit based in Los Angeles County, and we work with survivors of human trafficking, and we'll talk a little bit more about the definition, but we work with both survivors of sex trafficking and labor trafficking. We were founded in 1998 in direct response to El Monte sweatshop case. El Monte is a city in Los Angeles County where 72 Thai immigrants were kept in slavery and debt bondage. The picture there that you see is from an LA Times article, but it's the El Monte sweatshop case occurred in 1995, and we were founded in 1998, and we are the only organization, or the first organization in the US exclusively dedicated to working with human trafficking survivors. We're both nationally and internationally recognized. We not only provide direct services to our survivors, but we also do a lot of policy work, policy advocacy, survivor leadership. In the intro, Rayanne mentioned that Phil was part of the task force, so we also have someone from CAST, like Phil, to represent CAST at the Sheriff's Department. We are client-centered, survivor-informed organization. And we'll briefly talk later about what specifically for our social services program, what our program looks like for survivors of human trafficking. We call it, we use an empowerment model. So we'll talk more about that in a bit. So scope of the problem. So this is, a little bit outdated, but it still stands as far as the top countries that we're seeing our clients coming from. And then I think it also highlights, I think a lot of individuals think when they hear of human trafficking, and that has to do with the media or, the movies that we see, is that it's just a women's and children's issue, and it's not. We do have male clients in our caseloads, and we see both labor and sex trafficking as well. Some of the numbers specifically, like with male clients, appear to be low, and that's really not because there aren't survivors that are male identified, but because we have poor tracking and poor data when it comes to the demographics of survivors, and also to, I'm sure, with folks who, in this organization with Hope International, when you deal with survivors, sometimes there's a stigma about men getting help, and so obviously that will probably plays into these low numbers. But yeah, so our top countries are the US, Mexico, and Philippines. And again, we'll talk more about some of the myths regarding human trafficking survivors, but I know that when I first was introduced to CAST in 2008, we primarily worked with foreign nationals, and we rarely saw folks who were US born citizens who were trafficked. But now, given the attention that this issue has had in our local, state, and federal governments, we now are seeing more domestic survivors of human trafficking. So this is, if folks are familiar with Los Angeles County, this just shows a little bit, shows a snapshot of some of where our clients were escaped from or were being trafficked in. So as folks can see, it's all over Los Angeles County. It's not just in one area. And we'll talk more later about who these traffickers are, because they could be not only folks who have had a history of committing crimes, who are gang involved, but also diplomats, wealthy families, friends. There really is no correct or accurate picture of who a trafficker is. It really could be anybody. And Los Angeles is one of the top 3 points of entry into the country, so for survivors of human trafficking. So it happens, I think CAST is perfectly located in a place where, unfortunately, we do see more survivors of human trafficking compared to the rest of the country. And so this is just some other numbers that we pulled up from the International Labor Organization. And again, as I mentioned earlier, at the end of the day, there's no good data. The problem with working with human trafficking is that there is under-identification. And that's why, these type of trainings that we're doing with Hope International and just other trainings is important, so we can educate the communities, the social service communities and social service providers on this topic, so they could better understand how to work with these individuals, as well as possibly even track, who they're seeing and if they are a survivor of human trafficking. A couple of other just reasons why there is no good data. There's no annual count ever provided by the US government to estimate the number of victims of trafficking within the US. And as I mentioned, just given also to the issue being something that is not really well known sometimes in communities, social service providers or other organizations don't know how to define or know that is human trafficking is what they're seeing with their clients or the families they're working with. Human trafficking is the second largest organized crime. And the US government estimates large numbers, but so many people think of it only as an international problem. And like I mentioned, it's not. It's also a problem in the US. Another reason for poor data is because victims do not self-identify and many times are simply deported before advocates know their full story.
And as part of our trainings, we always like to just review, after giving a big picture overview, what we're talking about when we use the term human trafficking and in this discussion. As many of you may already have experience with, there's kind of a wide spectrum of representation in the media, but even in our own practice in our work, as it's relative to like the sexual assault and domestic violence movement, it's relatively young as the anti-trafficking movement, and so there's still sometimes some, I guess, loosey-goosiness when people are viewing this issue and how they're defining it internally for themselves. But at CAST, we, as Angie mentioned, when we formed, it was before there were actually any federal trafficking statutes on the books. So that El Monte case, when it was eventually brought to prosecution, was prosecuted based on the 13th Amendment as an anti-slavery case. So that was one of the sort of pivotal moments that brought legislators and advocates together to establish the Trafficking and Violence Prevention Act of 2000. So this is language based on the federal statute, again, of that act, in how a trafficking victim is defined by the law in the U.S. Here in California, we since have a California state human trafficking statute that mirrors this language quite a bit. And seeing in the chat the wide range of participants in this webinar, which is really great. I know different states have at different times incorporated their own statutes, some more consistent than others, so that's also something worth looking at some point, depending on your role, and especially if you have a lot of intersection with the court system or victim advocacy in that arena. But so, you know, using the federal statute as our example, we talk about both sex and labor trafficking here, and on the sex trafficking side, we really use that definition of anyone who's induced through that, and the keywords being force, fraud, or coercion in a commercial sex act or in commercial sex. The big kind of caveat here is anyone under the age of 18, any minor, that element of force, fraud, or coercion is not required, so it could just be a minor engaged in commercial sex is considered a trafficked person. On the labor trafficking side, quite similar as you can see it, but it involves recruiting, harboring, transporting, providing, or obtaining a person for labor services, and again, needing that force, fraud, or coercion element, and then for the end result of some type of forced labor, including involuntary servitude, peonage, debt bondage, or a slavery type situation. And just to break that up a little bit, we kind of interpret this definition through three lenses, and this really comes into play when we're first working with clients and understanding their case, and for those who might be legal providers on the line, and we at CAST, we have a legal department internally too, so that's where, just in an effort to be trauma-informed, we as social workers don't always dive too much into the facts of someone's case unless obviously they're forthcoming with it or it's relevant to the work, but often as social workers it's really not always relevant to need to go into so much detail, but a lot of times our attorneys are working through these facts to also understand what like legal remedies might be available to the clients we work with. But when we're looking at a case, we're always trying to identify that process means an end, and so that process being how someone was obtained or recruited or harbored or moved or really brought into the situation is that process piece. And then the means that we're always looking for, both for labor and sex trafficking, is some element of force or fraud or coercion. And that can take many different shapes, as we'll talk about. And then ultimately you need that end result of what someone was coerced or forced to do, some element of work or commercial sex. And again, for minors, as you can see below, that means piece is not required by the law if it's something related to commercial sex, because that's automatically seen as a human trafficking situation. and just in interpreting this too, we do sometimes have, I think early on, Angie mentioned we have a 24-hour hotline for LA County, and that's a big way through which we connect with potential victims and clients. And we do encounter folks who might have experienced some element of 1 and 2, some sort of fraudulent recruitment, and maybe then there was a threat to stay in the job or to do some sort of job, but then they left. And that's where we wouldn't have an end, quote unquote, in their situation. So it might not necessarily be a trafficking case. And then to break out that term coercion, right? Because that sometimes can be loosely interpreted or defined in different ways. And it often is a catch-all for the experience that our clients go through, even our clients who have endured some sort of physical abuse. There's an element of psychological coercion as well, or that physical abuse itself is a type of coercion to create that atmosphere of fear and threat. And as you can see here, there's sort of variations on how this could look. It might be the abuse or threat of using the legal process, like threatening to deport someone, for example, or we often see survivors whose trafficker force them to commit crimes and use that against them to hold over their head to keep them in their situation. But we really like this idea as a sort of summary of what we think of when we talk about coercion. And this is where when we talk, especially when we talk to clients initially, because as Angie mentioned, a lot of people, I would say most people, are not coming through our doors raising their hands saying, I'm a human trafficking victim and I'm looking for help. It's usually a much different path to get to that point, and there's, whether it's not identifying as a victim of anything or not being able to kind of piece apart the experience they've been through, and they're still working through that fear and intimidation from their trafficker. They might be really reluctant to share certain facts. So, for example, when we work with law enforcement on trainings, we encourage moving away from questions like, well, could you leave? Because a lot of times, a lot of our victims aren't physically restrained, so they might have been able to come and go from a house where they're living or a job while being trafficked. But when we start to ask, what did you think would happen if you tried to leave? And that's where we start to piece out this coercion component, because then they say, yeah, I could have walked in and out, but if I had done so, they told me, and they would, harm my family in my home country or something like that. And then Angie mentioned just some kind of common misconceptions that we see in the work, and though, in talking about LA, for example, and us being near borders and there being potentially high risk for trafficking, that there is sometimes a misconception between smuggling and movement and trafficking, and though that's often a component to some of our clients' trafficking experience, some element of movement, it's definitely not required. So it doesn't require crossing any borders, and we have many clients who are, trafficked in their home and they never go anywhere by a family member. So just always like to highlight that. We do see some stigma in different, elements of society, especially in stakeholders who, like, for example, let's say the criminal justice system or something like that, where our clients might interface with that. And let's take labor trafficking, for example, where there's maybe less attention around that in the U.S., and there's sometimes stigma that, oh, well, this is just a bad job that you got yourself into. And so one thing is, we always say you can't consent to being trafficked, because if you're identifying that force, fraud, or coercion component, then it's definitely not consensual. We also see a lot of clients who do receive some element of pay while they're being trafficked, and that the trafficking component is still there, and that simply being paid doesn't mean that it's no longer a trafficking situation. And then there is often gray area, especially when we're talking about labor trafficking of what's exploitation, what's human trafficking, and we do really like to see or visualize trafficking as on a spectrum of exploitation. So we do, field a lot of calls on our hotline where people are describing what ends up amounting to just wage theft. We do have a lot of trafficking survivor clients who experience wage theft as part of their trafficking situation, but that's where sometimes there's overlap and gray area, but the big kind of definer is, say it's an exploitative job where someone's not getting paid what they feel like they should, long hours, et cetera, and their sort of experience of that work is more, I don't feel like I could find something else, versus there was something communicated to me or demonstrated to me that made me feel like something bad would happen to me or my family if I left. And that's where that we get into, the far side of the spectrum of trafficking. And then I know doing this on webinar is a little bit different to be interactive, but when we work with partners on trainings around this, this is just a sampling of some of the fields of work and industries that we see people trafficked in, and mentioning that because often like to ask if there's anything sort of surprising or that jumps out to people about any of these industries, but without being able to do that necessarily, I might just highlight that obviously sex work and commercial sex encompasses a lot of the sex trafficking side, though these other fields of work are quite prominent too. I would say when we did an analysis of 2 years ago, we looked at just over 500 labor trafficking cases we'd seen at CAST to understand, again, to Angie's point with data, not necessarily prevalence, but because we didn't have the capacity to do that, but at least we'd seen enough cases to maybe have some trends and summaries to offer. And for us, of the clients we were seeing in LA, restaurant work, domestic service, construction, agriculture, and hospitality and hotels were some of the biggest industries that we were seeing folks trafficked in. And again, as we'll get into a little bit, the kind of common denominator here is really vulnerability. So there isn't necessarily any particular predictor of who is most likely to be trafficked, but for example, those industries I just mentioned, if we look for what might thread them through, we can talk about their industries where there's maybe less regulation. There might also be more diffuse employment structures where you have a lot of labor contractors providing the labor for a hotel or for a construction site or for a farm. And when you diffuse things out that way too, you end up with maybe more room for an exploiter to be part of that mix. And obviously domestic service and domestic work is one of the most sort of behind closed doors, literally and figuratively, and unregulated with minimal oversight fields of work. And then one last component we also like to mention, it says here forced to sell or cultivate drugs, which we do see a lot of, but in addition to that, we've been really trying to capture more how many clients we see who we would define as being trafficked for what we're calling forced criminality. And again, I think I mentioned that earlier, where we'll have cases of traffickers forcing someone to commit crimes like identity theft or credit card fraud or drug trafficking or drug selling or something like that. And again, it's a way of building more coercion into the experience, because they can then hold that above them, saying, okay, well, if you don't do this for me, I'm going to turn you in, you'll never see your family again, or I'll get you deported, et cetera, et cetera. And then just lastly, we do see clients who have a myriad of experiences where there might be traffic for both sex and labor too. And then again, thinking and talking about vulnerability is that common denominator in the cases we see, and this is where we'll tease some of this out a little more when we talk about the impact of the pandemic and COVID in both our current clients and new clients coming through the door. Really, marginalization and vulnerability being the biggest ones. We see that in the form of poverty, obviously, marginalization and discrimination societally, some sort of personal disruption, maybe civil unrest in locally or in their home country, and then some pull factors of the need for that type of labor or service or something like that, and just in general, the room through which marginalized groups can be taken advantage of, especially in the U.S. And one thing I just highlight here is as we talk about COVID impacts later on, these might seem familiar in the sense of when we're looking at more broadly and in the news the groups who are most disproportionately affected by both the pandemic and the economic fallout. You know, these are some common vulnerability areas that directly play to that too. So that's already one of the very close connections we're seeing between trafficking vulnerability and the really significant impact of this pandemic. And then, as Angie mentioned too, just really quick, we do see a pretty broad spectrum in terms of who are traffickers. And there often isn't some sort of, formula for it. Organized crime and gangs do get a lot of attention, though and studies have shown that most frequently traffickers are either small groups or individuals. And when we say small group crime, it's defined, at least in some recent studies, as I think 5 or less people. So even in our organized crime and gang cases, it might be members of entities like that that are engaged in bigger picture group crime, but then it's sort of a smaller group of individuals part of that organization that are engaged in trafficking, human trafficking. But again, it can look lots of different ways. We do see, business entities themselves built into their, kind of baked into their way of operating where they're trafficking folks on a more systemic level. Diplomats, as Angie mentioned, but one thing that really comes through for sure are friends, family members, and people known quite well to the victims. And that's, again, something we see with a lot of overlap with the DV, intimate partner violence and sexual assault kind of work that I know many of you all are engaged in.
And just a couple of examples. Sorry, Phil. Just so they can kind of get a picture of how it looks like. We've had one currently in our caseload that was trafficked by their parents, and we have one elderly person who was trafficked by her church. So really, it's, again, I think given the media and what we see in the news and in movies, it's not just the organized crime gangs. It really just an example of how it could be anybody. So now we're going to talk about the intersection of human trafficking, intimate partner violence, and sexual violence. So I'm going to go over some of these theories and tools that are used when discussing what survivors of any form of abuse, of domestic violence, sexual assault, or human trafficking, to help explain sort of what is it, the process that they're going through and what their trauma looks like, and help kind of better explain why there are some similarities. But I also just want to preface it with, that they shouldn't be treated similarly. Someone who's maybe gone through sexual assault, or it's been a victim of sexual assault, a victim of domestic violence and human trafficking. And we have had human trafficking survivors who unfortunately later become engage in a relationship that becomes violent, or who've had suffered from complex trauma, so maybe sexual assault before they were trafficked. Um, but we've also have had clients who've come from affluent families who are had pretty good childhood memories and upbringings, and then wanted to take an opportunity to come to this country, and unfortunately they became victims to human trafficking. So so not necessarily, basically not making assumptions that this person, um, aside from being a survivor of human trafficking, has also dealt with other forms of trauma or other abuses. So I'm not sure if any of you have seen this before, but this is the Maslow's hierarchy of needs. Um, and basically it's a theory comprising of 5 tiers that are human needs. And what it indicates is, or what it's showing is that the lower in the lower category, which is physiological, it must be satisfied to go to the next tier. So once your physiological needs are met, then your safety needs, uh, you can go up to safety needs, and then the goal at the end is to reach to self-actualization. And so the reason I share this is because similarly with survivors of domestic violence and sexual assault, in some situations we have the abusers sort of use this to use this theory to take advantage of our survivors. So we have had, for the survivors who have maybe lived in abusive households, or who have been in abusive relationships, or who have witnessed crime or gang violence in their communities, may be lured by the trafficker. The trafficker promises them um, food, a place to sleep, a roof over their heads, so meeting their physiological needs, their safety, keeping them safe away from the abuse that they were exposed to, and then even providing love through a relationship, or just being affectionate towards that person. And so what you see here is that they're using these tactics to, and I'll talk more about power and control, to gain that power and control over that individual. And so we have had some clients, similarly to folks who have suffered other crimes like domestic violence and sexual assault, who felt an emotional connection with their trafficker because of the things that they provided for them. And so obviously in those situations we do want to make sure that that person is connected to mental health services, and do a lot of psychoeducation on trafficking and trauma. But you know, you may have a client, or you may have a person walking through your doors, not really being aware or acknowledging that they are a survivor, or a victim of crime, some sort of crime, like human trafficking or domestic violence or sexual assault. So, and I'm sorry this slide is a little bit blurry, but if you have a chance to Google the Power and Control Wheel, I highly recommend it, because it is a tool that's used, mostly it's been used when talking about domestic violence, but you could also use it when discussing sex trafficking and labor trafficking. And so these are some of the examples of what traffickers do to ensure that they have control over that survivor, over that individual. So, you know, the common things we see is physical abuse, sexual abuse, psychological abuse, but then there's coercion and threats. We have individuals who or clients who've feared, they told us that they feared to leave or escape because of threats that were made to cause harm to their families back home. Or sometimes, unfortunately, well, not unfortunately, but, or yes, unfortunately, the survivors are sexually assaulted by the traffickers, and then due to that assault, they become pregnant, and then they have their, their child, and so the trafficker um, uh, threatens to, take their child away from them if they leave, or also as well, we've seen clients who've been uh, threatened to be deported. And although, obviously their situation, this human trafficking situation is traumatic, and they're dealing with all forms of abuse. Sometimes some of these individuals are fleeing countries where there is civil wars or violence, and so being threatened to be deported is also obviously not, is something that the abuser uses because they know that that person also is not wanting to, go back home. And so this is just a graph of some of the things that our survivors of labor trafficking have suffered aside from human trafficking. And so the reason we wanted to share this is because we, as you can see, we have had clients who've been victims of domestic violence as well as sexual assault and sexual abuse. And they were a survivor of labor trafficking. So although we do have clients who are survivors of sex trafficking, and obviously then they're also a victim of sexual assault, we also see this with our labor trafficking cases as well. Phil, was there anything you wanted to share about that, or were you about this?
Yeah, just as you mentioned, in when we are looking at the folks we work with is, again, someone coming through the door who people present, openly with either the information or the self-identification or whatever that helps us understand if they've experienced trafficking. And this is an area that has been really useful for us when we talk to our healthcare and hospital partners, law enforcement, et cetera, where, and I think in our chat we saw some forensic interviewers and DA advocates in the audience, and where someone might be coming to you or interfacing with you, and all you know is they've experienced sexual assault. But that's where and I think it's understood that we definitely see a high prevalence of that type of trauma for folks who are trafficked for sex, but it's also used as a coercive tool in labor trafficking situations, et cetera.
And I wanted to share, I don't know why it's not popping up. So some of the stats that we're providing, specifically this graph, as well as, because I see a question regarding stats. I know questions are at the end, but I did want to share, are from our database system at CAST. So this isn't stats that we're gathering locally or state or even national. It's from our client database system that we use, and we track these cases and what they've been through.
Yeah, and this data, our labor trafficking report, I'll put in the chat a link because it is a public report we have now. Again, the one I mentioned where we were analyzing about 500 labor trafficking cases over the last 10 years or so.
And I'm going to do a plug on our website has resources that have more stats and specifics about the work that we do and what we are seeing, as well as our annual report has, because some folks had questions about our hotline numbers, about what we're seeing in regards to clients calling into our hotline or potential survivors of human trafficking. Oh, I should have done that. Okay, well, there you go. CAST labor trafficking cases from 1999 to 2018. So here's a quick video of that kind of just shows faces of human trafficking, and some of the folks in this video are clients that we have seen. So yeah.
My trafficker was my husband. There was no way I could reach out to anybody for help.
We're scared. We're scared to run. We're scared to tell anybody what's going on.
It was an incredibly violent situation. I felt like there was no way I could get out.
It was awful. The whole experience.
I was full-time babysitter and house cleaning, cooking. I wasn't getting paid. I was lied to, I was abused. I didn't know I was a victim of human trafficking until I told my story.
Human trafficking is really compelling someone to any form of work or service against their will.
Force, fraud, and coercion is really the crux of the crime.
Human traffickers can be just about anyone from any walk of life. Owners of small businesses, head of a household. A lot of the trafficking involves domestic servitude. Hoteliers, restaurant owners, owners of massage parlors, agricultural farm owners.
It can be a trafficker who tells a woman, I want to be your boyfriend, I love you, and if you love me, you're going to go out and have sex for money. It can be kind of psychological like that, or it can be more overt and more physical. It can be hitting, abusing, keeping them away from any support systems.
They may have their documents taken away from them, their passport and things like that, and they're sort of held in a way that makes them fearful to complain. And if they do complain, then they're fired.
One myth about trafficking is that it involves people being smuggled in containers across borders. Smuggling is a crime against a border. Trafficking is a crime against a person.
I still see this attitude of it's just immigrants or it's just people in other countries. It happens to U.S. citizens so much more than people are aware.
There really is no one profile of a trafficked person. There are clearly themes or patterns, but if you look through the investigation reports, you'll see cases that are very, very diverse.
Trafficking, it doesn't know any boundaries. And it happens all over America. So I came from kind of a more privileged background, but it still happened to me, and a male. The victim can be male, female, transgendered, anyone.
There's a myth out there, partly because of movies, that trafficking victims are chained up, and that's not the case, but it doesn't make the victim any less unable to leave. Oftentimes they're worried for their family members. Traffickers will often say, I know people that will do things to them.
We need to understand that freedom of movement does not equal freedom of choice. Most of the time, being trapped is something we can't see. It's something that a trafficker pinpoints as a vulnerability and is able to use against the victim.
You're initially brainwashed, and then over a period of time you become conditioned where you start to accept that this is all you can do.
The natural stakeholders in this issue are certainly law enforcement, legal advocates, social service providers. There's other players involved as well.
It is important to engage the community in human trafficking cases because victims often don't self-identify. They don't come forward to law enforcement.
Okay, thank you, bye-bye.
We
I try to make sure the community is educated regarding human trafficking, because those citizens in the community are the eyes and the ears.
It's medical workers, it's educators, it's personnel at homeless shelters.
There has to be a support system within the community, psychological counseling, shelter, and vocational education, so they can reintegrate, become a healthy individual.
We can't do this alone. No one has the capacity to provide every single thing that a victim or survivor of human trafficking needs.
There's an intentional effort to get everyone together so we know how to share resources, we know how to work together, and to make sure at the end of the day, a victim becomes a survivor.
So someone who was in our video, her name is Ema. She's actually our Survivor Leadership Program manager. And she actually, during the Obama administration, was part of Obama's Human Trafficking Committee. So just an example of someone who was started out as a client, a CAST client, went through our services, got the help that she needed, and is now managing our Survivor Leadership Program, because the goal with all of the clients that we see is for them to hopefully get them engaged in the anti-trafficking movement through the Survivor Leadership Program or other forms of advocacy that we are involved in. So identifying survivors. So these are just examples, along with physical, psychological, and sexual abuse and threats that we see with individuals who are being trafficked. So we're seeing the long hours, the withholding of documents, having to work when sick, threats to family members in home country, which is what I mentioned before. And again, I mean, these are some examples, but of course, I mean, like we say with all our service providers that we do trainings for, you know, just whatever your gut feeling is telling you, if something just doesn't feel right, just get the consultation. Or, you know, for CAST in particular, we have a hotline that you can call, and if you need some resources or just someone to consult with regarding a possible client that may be trafficked, we're available. We're a resource, and at the end of the presentation, we'll provide you that hotline number, as well as the National Human Trafficking Hotline number. And so when you see this, obviously, you know, hopefully you don't want to jump into saying, okay, long hours, that, you know, that person could be trafficked. Assess, try to ask more information or questions. As Phil mentioned, there's also sometimes some confusion with labor exploitation, where we do have clients, and we've had individuals call and saying that they are working long hours with their job, and their boss is being verbally abusive towards them. And so when we assess a little bit more and find that there are no threats or coercion or psychological physical abuse, this may be more of a case of labor exploitation, which is still an issue. And definitely individuals who call our hotline who may not meet the definition of human trafficking, we provide them resources for other organizations, like either domestic violence or a legal aid organization that can help them if it is a labor exploitation case. So why survivors may not appear to want help. And Phil mentioned this earlier, not seeing themselves as a victim, not knowing that there are resources and help out there for them. is one. Lack of knowledge, as well as distrust of social systems and distrust of law enforcement. I think right now, with everything that we're seeing, dealing with the social issues in our country, traffickers use that to scare the survivors of for them not to want to flee. So when we see violence on the TV, or we see things that are the media and the news, they may use that as a tactic to instill more fear in the client. And also too, unfortunately, we've had clients who were trafficked by some of these entities, like law enforcement, social service providers, Department of Children and Family Services, or have felt not heard, or felt that this person could truly help them flee from their situation. And so those are just some examples of why survivors may not want help. Use and threat of violence, of course, trauma and cognitive distortion. So given their level of trauma and kind of connected to Stockholm Syndrome, sometimes there is an emotional connection with the trafficker. And we see this a lot with what we call our CSEC clients, our commercially sexually exploited children. So children or minors who are survivors of human trafficking. We see this a lot of us working with them on understanding that what they went through was an abuse, and a lot of it we do have to connect with mental health service providers. But that becomes a challenge sometimes, because we do unfortunately have clients who do go back to their trafficker. But we don't, with CAST, we meet them where they're at. So that way they know that when they are ready to flee, or they are ready to receive that help, that, we will be there for them when they're ready. So some key questions to keep in mind, and just to say that obviously we hope that, hopefully this training is providing you some insight, and it's been informative for you on the topic of human trafficking. But at the same time, even including myself, sometimes I still have to ask our attorneys and some other staff members about particular situations and whether that does fall under human trafficking or not. So, we'll, obviously these are some of the questions that you could ask, or maybe assess a little bit more, but also to, call our hotline, call the national hotline, just to gather more information, just to make sure if this is someone who is a survivor of human trafficking, and connect them to services that could, help them. So was the person recruited? Were passports or other identity documents taken? Were they paid, not paid? What were their working conditions? Were they coerced? Were there physical threats, psychological threats? Did they want to leave and they couldn't leave? And this is a question we comes up a lot when we're trying to assess if it's labor exploitation or human trafficking, although that it is an unfortunate situation that they're working in a job that, is long hours and bad working conditions, but are they able to leave? Is the person afraid of his or her employer, and why?
Thanks, Angie. Yeah, and that's a kind of great jumping off point, because I think when we talk about engaging trafficking survivors, or for folks who are potentially already either working on trafficking cases, or they think they might and they just weren't seeing it before, I think sometimes our partners receive this information or start thinking about it maybe differently, and there's often a jump to, okay, so I need to ask every question correctly, and I need to, or I need to like rescue this person because they just told me they've been trafficked. I need to figure out how to do this. And as Angie mentioned early on, We very much have an empowerment approach to working with clients. So we, from the get-go, try to incorporate an element of agency and choice in even, through our 24-hour hotline. If someone's in LA County, we have an in-person response program where we respond out and help people who have just escaped, or we've talked them through escaping a trafficking situation. And even from those initial moments, we're incorporating elements of choice. And I just wanted to mention that because as we start talking about needs of trafficking survivors, I think there was a quote in that from one of the interviewees in that video we watched, who was mentioning that once you start getting conditioned in that experience, you start to feel like, okay, well, this is all that is available to me in life, or this is what I was meant for, or something like that. So we're not only working to help someone see beyond that, which is its own challenge, but in addition, that Maslow's hierarchy of needs that Angie went over is often really manipulated by traffickers, so that it's our job as practitioners and providers, regardless of our role, even if we're a good Samaritan and just trying to offer that support to someone we feel like might need it, that it's not about tell me everything that happened to you, or you need to come with, there's, I think, sometimes a knee-jerk reaction to control what people who have experienced trafficking do next. And we just always like to emphasize that it might not look like what we expect initially, but that it should really be driven by the client from the get-go. And that includes when we talk about needs, because we look at that Maslow's hierarchy, we need to make sure we're doing everything we can so that our provision of that support far exceeds whatever they were experiencing in their trafficking situation. Otherwise, what's the incentive for, feeling like there's something better out there? So one of the things we look at is a whole scope of legal needs for trafficking survivors, and as you can imagine, it's a lot. We work both with U.S. citizens and foreign nationals, so there's sometimes, for some clients, immigration avenues we can pursue. For foreign national trafficking survivors, they're often eligible for a specialized visa. I know many of you are probably well acquainted with U visas. There's a T visa for trafficking survivors that can be applied for, which is comes with work authorization and a pathway to residency, as well as a lot of criminal justice issues and stuff like that. And I'm going to move through these a little more quickly so we can get to the COVID portion, but also a whole holistic range of social service needs and things to think about. But really the key, as with much of our work that we all do, is that safety component, and a lot of these basic needs elements and long-term support. The number one thing when we solicit feedback from our clients is if we've done a good job providing a sense of safety, because nothing else can kind of come without that. And I mentioned this a little bit already, but we really seek this approach of being both trauma-informed and client-centered in our work. And as we start talking about the impact of COVID, want to just highlight that has sort of hit home even more as we're working both with new clients and folks that we've been working with for a while, who are all of a sudden much less stable than they were previously. And so, when this pandemic first started and we were looking at how it was impacting our clients, and there was a lot of attention, at least locally in LA, around increased cases of domestic violence, and that was, making sense of people potentially more restricted or with their abuser exploiter in a safer at home situation, because here in LA we had and still have safer at home restrictions going on. And we had initially seen a bit of a decrease, about a 50% decrease in our hotline calls. And our sort of educated guess was that in both sex and labor trafficking situations, people had less opportunity to maybe make that telephone call or find out that help was available to them. While at the same time, we saw a huge uptick in what our current caseload, and we work with yearly, we serve around 500 unique cases, in addition to about 1,500-ish hotline calls that we get every year. And so of that caseload across all our programs, we're seeing a lot of needs, people who had been much more stable but were really impacted by, rent issues or unemployment or what have you, or health issues as well.
And that
so kind of to that
sorry,
point.
Sorry, Phil, and just really quick, and that has definitely helped us in determining what grants we need to be seeking, because now obviously the needs have changed. So, whether it be focused on housing so the person is able to keep up with their rent, or if it's even things like getting a computer or a laptop or a smartphone, because now everything is telehealth and we're all doing video conferencing. So our grants are definitely being affected, and having to kind of just be flexible as far as how we're working with our clients, because we are working remotely. Sorry, go ahead.
Yeah, and so that's a great point, because as we've seen, as you can see, some of these increase, a lot of, we've seen both an increase eventually of people escaping their trafficking situation compared to the same period last year. And then to Angie's point, our case managers are spending a huge percentage of time now dealing with emergency needs compared to what they were last year. And that includes really like basic needs stuff, rental assistance, what have you. And I think there's a question kind of applicable to this, how you can help someone who is in the process waiting for their immigration case with basic needs, and it's a really tricky situation. It varies state by state. In California, there are resources for what are called pre-T visa folks who are eligible for public benefits if they've applied or in the process of applying for a T visa. But we've been really exploring, as Angie mentioned, with our funding and the grants we're applying for, as much as we can, more open-ended funding and less, and I know finding unrestricted funding is like one of the more impossible things or challenging things in this field that many of you are probably familiar with. But we have a couple of grants that have really loosened up their restrictions on things, and we've been finding really effective use of just trying to infuse, whether it's cash or rental assistance or that immediate help for folks so that they can stay afloat, so that they're not vulnerable to some sort of other exploitation or re-trafficking potentially down the line. This just goes to show one of those elements we've seen, and this was in our last couple months, a huge increase of potential victims themselves calling us. It's our fastest growing sort of breakdown of our hotline callers, and 72% of those folks report being homeless when they call. So housing, no surprise, is still a major issue and need on our end. Kind of wanted to bring this back because these are the trends we're seeing of the folks we serve during COVID. And if you remember the slide prior when we were talking about social service needs, it doesn't look all that different. It's really a lot of the same things that we need to be focusing on for the folks that we support. And if anything, it's just more magnified or extreme, the level of need that we're seeing come through. So that's something just to think about. It doesn't always, there's a lot of attention around what COVID means for our clients and et cetera, and it might, for us, it hasn't necessarily meant reinventing the wheel, just rethinking things and really trying to find out how we can maximize the resources we have to be of as much assistance as we can during this time.
And just some examples of what that looks like. Yeah, thank you, Phil. Is is, you know, when all of this started, there were so many resources, and I'm sure you guys have all seen this, are all seeing this, of resources coming our way in regard, like new grants the city was giving, or rental assistance, things like that. And so there was a lot of information coming our way, and we were having to try to organize that. So we used our MSW, our Masters in Social Work interns, to help create a Google Doc of all those resources. So we've had to just think of it, when this happened, think strategically and creatively, okay, now what can we do to make this process a little bit smoother for us? And so and some of these things had to be thinking outside the box of what we could do. Another thing I want to add that's really important as a reminder, the self-care piece. We have now something called Wellness Wednesday, which we haven't had before, where we run a self-care activity on a Wednesday for an hour once a week for all our staff. And we do have multiple check-ins as well with staff about how they're doing. And so that's also very important with, you know, maybe it's something that you can start with in your agency, because, you know, given everything that's happening and having to work from home and dealing with things in your personal life as well as your work and having to balance that out, it's really important that we acknowledge and that, you know, that we need that self-care. And so we want to make sure that we remind our staff that is important.
Thanks, Angie. And I think we're kind of at time and want to open it up for questions. When you download our slides, you'll see our hotline numbers included for folks. We really mainly have resources and connections, mostly California-based. If people call the CAST hotline directly, our both remote and in-person services for survivors are really focused in LA County. So outside of that, we encourage people to call the national hotline. But we also have below here a technical assistance email as well, and that's, I'll put in the chat a link to our technical assistance page, because I know we mentioned a little bit touching on screening for trafficking cases and questions to ask, but there's a lot more specific training around that our TA program provides. Especially to help folks be mindful of their role and their confidentiality and privilege obligations to make sure that everything is as best practices can be working with trafficking survivors.
Thank you, Philip and Angie, very much for this amazing information. We have 15 minutes and a lot of really great questions. So I'm going to go out of order because there are a couple of questions that are directly related to what you just talked about regarding COVID. So I'm going to start with those two first and then go back up and catch some of the other questions. So one of the questions is, how difficult is it for your staff working in person with survivors due to COVID?
Right now, our case managers are working from home. So unfortunately, we are not at the office where we would usually meet our clients. And actually, before COVID, 80% of our work was out in the field. And obviously, that was due to help model to the client, you know, how to advocate for themselves and connect with them in their communities. But unfortunately, just to make sure to keep our staff safe as well as the clients safe, we have to work from home. But we do, you know, if need be, if there's a crisis or there's an urgent matter that it's better to be in person, then we'll be flexible with that. But the majority of time is us working from home.
Okay.
And it is as Phil mentioned, it is challenging, obviously, especially when we have to get into those having to do applications or having to sign up for benefits. So it is taking a lot of our time, unfortunately, due to that. So, yeah.
Yeah, and we've spent a lot of focusing resources also on getting technology access to our clients too. In particular, not just our minors, I guess, too. A lot of our adults are in school as well, but to be connected with us. So we've been fortunate to have some resources for that. But it's, to Angie's point, it's maneuvering a bit. A lot of our clients, to be frank, wouldn't have been comfortable coming in or aren't, and also might have pre-existing conditions or other health issues that we want to be cognizant of.
Okay, and that actually sort of transitions to the next question. So are people in human trafficking more likely to be at risk for COVID-19 infection?
That's a great question. I think when we look at both folks who are being trafficked, but also have moved beyond that, but are still working on their next steps in their journey, it's, you know, all those intersecting issues that we're seeing nationally as high risk, whether it comes to socioeconomic status, housing conditions, whether they have adequate access to health care, et cetera, to deal with pre-existing conditions. We see a lot of those issues present with our clients. Obviously, in trafficking situations, some of those conditions are often pretty horrendous too. So I think all of that, when we're viewing human trafficking as a public health issue, which, you know, many of us do, that it definitely links to risk factors, at least, you know, anecdotally from our end, to COVID risk, because you're looking at similar populations that have other vulnerabilities and risk factors.
Okay, and then another sort of related question is, have you noticed more cases or just more resources needed with COVID, or both?
That's a,
Go ahead.
yeah, Angie, you want to take that?
Well, we can both take it, but we have seen more resources are needed. We have seen more cases come in as in mostly for shelter. So we run an emergency shelter, and so and Phil, maybe you can talk more about that. We have seen more calls coming in requesting for that because due to the pandemic, they've become homeless because they lost their housing or loss of income. And with the clients we currently have in our caseload, we have had more challenges in finding resources, specifically financial resources for them because of loss of income.
Okay, thank you. Another COVID-related question. At a national level or state level, are any steps being taken to prevent online predators? Due to COVID-19, there is an unprecedented rise in screen time and safety risk to millions of young people who could potentially be trafficked.
I don't know in terms of coordinated efforts at the state or national level, but I do know because there's often overlap, we have some partners who focus on like internet crimes against children, and we obviously sometimes have clients who have been either recruited that way or whatnot, and there has been locally an increase in the cases they're seeing of internet crimes against children. I'm assuming related to the increase in screen time, but I'm not sure how that, I haven't heard of any coordinated efforts to, and maybe that'll come as there's better coordination of just what like schooling and screen time looks like, et cetera. But definitely when it comes to like, you know, recruitment risk and things like that, you know, the folks we work with, whether we see a lot of online recruitment, but I think we're going to just continue this as the economy suffers and this pandemic continues. People who are also either desperate for connection or financial means or jobs or whatever, and those are all moments when we've seen people become vulnerable to trafficking, both labor and sex.
Okay, thank you. Another question, do you have partnerships locally in each state for folks to access to provide referrals for survivors? Or do they connect you all directly via your hotline? What's the best way for agencies across the country to connect survivors?
I would say oh, sorry, Angie.
Go ahead, Phil. Go ahead.
For folks outside of California, I would recommend the national hotline and I'll go back to that slide, as a go-to point. Generally for LA County, the national hotline will connect someone to our hotline if that's where they're calling about. But we also have a pretty, we do have national connections to other agencies, but the national hotline is definitely most up to date with resources and where to go. So we would often be directing people that way a little bit as well. If it was outside of California, we do have more capacity to kind of do that connection or referral in California. But when it comes to our services specifically, it's really LA County based.
Okay, great. Then I'm going to go back to some of the earlier questions. There was one here. Let's see. Okay, so this one I'm sort of combining two questions. Somebody asked early on, how are diplomats involved with trafficking? So if you can give a really quick example of that, and also how somebody would be trafficked by their church.
Phil, you can talk more about the diplomat piece, but as far as the church, we've had the one client I was thinking of, who's an elderly client from China, was trafficked. She was, I believe she already had some connections or relationship with the church back in home country, and then was asked if she could come and help out with the church at here in the U.S. And then unfortunately the church took advantage of that individual and trafficked them and forced her to, it was a labor trafficking case. So that's one example of that. I mean, we've seen other cases, and Phil, you can speak more to it, of organizations like churches or faith-based organizations that have recruited individuals maybe back in home country, and then forced them to work here without pay, and also with psychological threats and physical threats as well.
Yeah, for sure. And we've seen that take different shapes. Like, for instance, the Church of Scientology, over the years, we've seen a lot of trafficking cases that folks have experienced all over the place, and usually it's forced labor of some sort, with a lot of, as you can imagine, it's, I think churches, bad actor churches, quote unquote, have the potential for what's it called? Yeah, like some of the more psychological coercion, I guess, that we'd see in trafficking cases a lot too. On the diplomat side, we've seen that take different shapes as well. Diplomats often have a lot of, I mean, they have like immunity from our legal system here in the U.S., and we've seen a lot of domestic servitude cases where they've facilitated bringing someone from their home country with the promise of a job, and then trafficking them in their own home for domestic servitude.
So we have just a few minutes left, but there's a question that is going to take us maybe down a different path, but I think it's just as important. There's a question that asks, are traffickers arrested and prosecuted for these crimes? And can you provide us a little information of what that might look like?
Phil, you want to take that one?
Yeah, traffickers are, so, you know, the statutes I mentioned, there are criminal statutes and civil statutes around human trafficking. The Trafficking and Violence and Prevention Act that I explained earlier at the federal level allows for both criminal and civil prosecution. And individual states have since enacted their own trafficking laws too. So in California, we see a lot of trafficking prosecutions. But the overwhelming majority at the prosecution level are sex trafficking cases. And of those, I would say we see a lot of prosecutions around sex trafficking of minors, and generally it's because they're easier to prove because you don't need that force, fraud, or coercion element. And then for labor trafficking, it seems it's a little bit of a combination of lack of awareness, lack of resources, because labor trafficking cases sometimes get more involved in getting corroborating evidence, but also with a lot of labor trafficking individuals being foreign nationals, there's often a reluctance or obstacles to cooperating with law enforcement and going through that process.
Okay, and then there's a related, sort of a related question. You're getting a lot of really amazing questions, so what we might have to do is send you some of these questions to have you answer, and then we can send back. But I want to ask you this one too. Do you know if there is a law to hold organized groups accountable, or do you have to have individual names within that particular organized group?
There have been cases, or at least attempts I've heard, where and again, this is not entirely my expertise or wheelhouse, and I'm not an attorney, but in our task force, we've seen some realm through which people have pursued a RICO prosecution, which is, I think, what this question is getting at, where you have ability to take on an organized group for that racketeering and coordination around committing the crime of trafficking. And that's happened in different contexts, both with like gangs and organized crime, but we've seen some attempts with cases with that racketeering coordination happening, like in agriculture, for example, in labor trafficking cases. So it happens both ways, but I think those are few and far between, and that generally RICO cases are somewhat complicated to bring for the threshold that they need to meet. So the majority are individuals that are brought in those cases.
Great. Well, we only have a couple minutes left, and like I said, we'll take the questions that have come through that we will send those to you to get to your responses and then send those back to the presenters. But in our last couple of minutes, do either one of you have any final thoughts for our audience?
I would say, from our end, and judging from these amazing questions and just all the comments throughout, that there's a lot of expertise in this audience too, and I think people will find and continue to find ways where human trafficking awareness and working with the population intersects, if it doesn't already, with the work you're doing. And so I think just bringing that expertise to relate, it doesn't always involve reinventing the wheel in terms of supporting folks, but it really, that as much as we can offer people choice and wraparound care and support is where we see the best outcomes for our clients too.
And I guess I know that we have participants from all over the country, and I think I saw someone from Brazil, so all over the world, but maybe taking some time to see what organizations in your area provide services to human trafficking survivors. Some of these are new and starting out, and so they have not maybe advertised as much. It may not be an agency solely like CAST where they are just working with human trafficking survivors, but may have a human trafficking program. I'm always surprised to hear about a new organization in different states starting a program specifically for working with human trafficking survivors. And also too, if you do encounter someone who may be a survivor of human trafficking, I'm glad that you guys attended this training, and hopefully it will help you in the assessing. But kind of treat them like any other of your clients that come through your door, with empathy, which I know you all are, because obviously you wouldn't be in this training if you did not care. I think someone asked, what to do with individuals who don't see themselves as a victim, is really just meeting them when they're at, being patient, providing that psychoeducation now that you have taken this training, and just remind them that whenever they are ready to get the help and support, you'll be there for them when they're ready to come back.
Thank you both, Philip and Angie, so much for your time. The comments that are coming through the chat, this was incredibly informative. Everybody's just thrilled with the information received. So thank you again for your time. And thank you, everybody, for taking time out of your day to join our presentation. We hope this will help you continue doing the amazing work you're already doing. If you would like more information, you can reach out to Alliance for Hope at info@allianceforhope.com, and we'll be happy to connect you to Philip and Angie. So wishing you all a wonderful day and a fabulous week.
Thank you.
Thank you very much.
Thank you. Take care, everyone.